It's an ordinary morning. You're making breakfast, taking your medications, and planning your day. Everything seems normal, just as it has for decades. But inside your chest, something is quietly changing. Your heart, the faithful organ that's been beating since before you were born, is sending you signals that it's aging faster than the rest of you. Signals you might be missing entirely. Did you know that heart disease remains the leading cause of death for people over 65, claiming more lives than cancer, respiratory diseases, and accidents combined? Even more alarming, many seniors never experience the classic warning signs we've all been taught to watch for. No chest pain, no shooting pain down the left arm, no dramatic collapse. Instead, their hearts whisper rather than shout, sending subtle signals that something isn't right long before a crisis occurs. What if the real warning signs have been hiding in plain sight all along? What if your changing energy levels, your sleep patterns, or even the appearance of your ankles have been trying to tell you something crucial about your heart? What if you've been dismissing as normal aging what your body has been desperately trying to communicate? Today, I'm going to reveal 7 silent, often overlooked signs that your heart might be aging faster than you are. These aren't the dramatic symptoms you see in movies or medical shows. These are the quiet changes that even doctors sometimes miss during your brief annual checkup. Changes that, if recognized early, could literally add years to your life. Whether you're 65, 75, or well into your 80s, understanding these signals isn't just important, it could be the difference between living fully for years to come or facing a sudden, preventable crisis. Because when it comes to your heart health, what you don't know absolutely can hurt you. Before we dive into these 7 critical warning signs, take a moment right now to hit that subscribe button and turn on notifications. Silent sign number 1, unusual fatigue that rest doesn't improve. Have you noticed yourself becoming increasingly tired during activities that used to be effortless? Perhaps you find yourself needing to sit down halfway through shopping trips that never bothered you before. Maybe gardening for just 20 minutes leaves you feeling completely drained, or walking to the mailbox suddenly requires a recovery period. Many seniors brush these changes off as just getting older, but this assumption could be dangerously misleading. When your heart isn't pumping efficiently, it struggles to deliver oxygen-rich blood to your muscles and organs. This oxygen deficit manifests as fatigue, not the normal tiredness after a busy day, but a profound, persistent exhaustion that rest doesn't seem to resolve. Your body is essentially running on low fuel constantly, and your heart is working overtime to compensate. Think about Elizabeth, a 72-year-old who always prided herself on keeping an immaculate garden. Over several months, she noticed she could no longer spend a full afternoon tending her flowers. She'd work for maybe 30 minutes before needing to sit down, feeling unusually winded and tired. "I just thought I was getting older," she told me. "I never connected it to my heart." But that unexplained fatigue was her heart sending a crucial message, one she unfortunately missed until she experienced a serious cardiac event months later. What makes this symptom particularly deceptive is its gradual onset. It doesn't happen overnight but creeps up so slowly that many seniors adjust their activities downward without realizing why. They simply accept that they can do less, when in reality, their heart is desperately signaling for attention. Think about your own energy levels compared to 6 months ago. Are you doing less? Have you subconsciously modified your routine to accommodate decreasing stamina? Have others commented that you seem to tire more easily? These questions aren't merely about quality of life, they could be illuminating a serious heart condition in its early stages. For women especially, unusual fatigue may be the primary warning sign of heart trouble. While men more commonly experience the classic chest pain or pressure, women often report overwhelming tiredness in the weeks or months before a cardiac event. This gender difference contributes to heart disease being underdiagnosed in women, often with devastating consequences. If you're experiencing fatigue that seems out of proportion to your activity level or doesn't improve with adequate rest, don't dismiss it. This could be your heart's first attempt to tell you something isn't right. Silent sign number 2, subtle changes in your breathing patterns. Do you find yourself slightly breathless after climbing a single flight of stairs? Perhaps you've noticed you need an extra pillow at night to breathe comfortably, or you wake up occasionally feeling like you can't get enough air. Pay close attention, these seemingly minor changes in breathing patterns can actually be significant indicators of heart aging. When your heart struggles to pump efficiently, fluid can back up into your lungs, a condition called pulmonary edema. Initially, this might only happen during exertion or when lying flat at night, a condition doctors call paroxysmal nocturnal dyspnea. Many seniors mistake these symptoms for normal aging, asthma, or bronchitis rather than recognizing the cardiac connection. Consider Richard's story. At 76, he started noticing he couldn't lie flat in bed anymore without feeling short of breath. "I thought it was just acid reflux," he explained. "So I started sleeping with 2 pillows instead of 1. What Richard didn't realize was that his heart was struggling to handle fluid redistribution when he was lying down, a classic early sign of heart failure that went unrecognized for months. Another breathing change to monitor is what doctors call exertional dyspnea, becoming unusually winded during activities that never troubled you before. If conversations leave you breathless, if you need to pause while climbing stairs you once took easily, or if you find yourself taking more frequent breathing breaks during routine tasks, your heart might be struggling to keep up with even modest oxygen demands. Ask yourself honestly, have your breathing habits changed over the past year? Do you avoid certain activities because they leave you short of breath? Have you added pillows to your bed setup without really thinking about why? These adjustments might seem insignificant, but they could be powerful clues about your heart's condition. The most dangerous aspect of these breathing changes is how easily we accommodate them without questioning why they're happening. We simply adapt, sleeping more upright, moving more slowly, avoiding stairs, never realizing these adjustments are actually adaptations to a struggling cardiovascular system. If you recognize these subtle breathing changes in yourself, don't wait for them to worsen. These could be early, critical warnings that your heart needs attention now, not later. Silent sign number 3, swelling that comes and goes. Have you noticed your shoes feeling tighter at the end of the day? Perhaps indentations from your socks that weren't there before? Maybe your rings feel snug sometimes, or you can't wear certain bracelets you used to enjoy? This subtle swelling, or edema, happens when your heart can't effectively pump blood back from your extremities. Gravity causes fluid to pool in your lower legs, ankles, and feet, especially after periods of standing or sitting. What makes this symptom easy to overlook is that it often develops gradually and may be painless. Many seniors assume it's related to arthritis, injury, or simply part of growing older. They might not connect this fluid retention with their heart health at all. Yet this silent sign could be an early indicator that your heart is struggling with its most basic function, maintaining proper circulation throughout your body. Margaret, an 81-year-old former teacher, noticed her feet would swell by evening, especially after days when she was more active. "I just figured it was because I was on my feet too much," she recalled. "I'd put them up at night and by morning they were fine again." What Margaret didn't realize was that this cycling pattern of swelling and recovery was actually a textbook early sign of heart failure, one that she dismissed for nearly a year. The connection works like this: when your heart's pumping capacity diminishes, blood returns more slowly from your legs and feet to your heart. This creates pressure in your veins, forcing fluid into surrounding tissues. Initially, this swelling might disappear overnight while you're lying down, making it easy to dismiss. But as heart function worsens, the swelling becomes more persistent and pronounced. Take a moment right now to examine your ankles and feet. Press firmly with your thumb against your shin bone for a few seconds. If an indentation remains after you remove your thumb, what doctors call pitting edema, this isn't something to ignore. This simple self-check could reveal important information about your heart's performance. Pay special attention if this swelling appears in both legs, rather than just one. Improves when you elevate your legs. Worsens by the end of the day. Has been gradually getting more noticeable. These patterns often signal that your heart isn't efficiently handling fluid return, a problem that typically worsens over time if left unaddressed. While mild swelling might seem merely inconvenient, it represents an important warning from your cardiovascular system that shouldn't be dismissed. Silent sign number 4, changes in your sleep patterns and quality. Has your once restful sleep become fragmented or disturbed? Do you wake up feeling unrest despite seemingly adequate hours in bed? Or perhaps you've developed sleep apnea, where your breathing stops and starts throughout the night? These sleep disturbances might be more than just annoying inconveniences, they could be your heart sending distress signals. The relationship between sleep and heart health works both ways. Heart problems can disrupt your sleep, and poor sleep can exacerbate heart conditions. This dangerous cycle often goes unrecognized, especially by seniors who may attribute sleep changes to aging rather than seeing them as potential cardiac warning signs. Consider James, a 79-year-old who always enjoyed good sleep until he began waking up mysteriously at 2 o'clock or 3 a.m. feeling anxious and short of breath. "I thought it was stress or maybe too much evening coffee," he explained. What James didn't realize was that these nighttime awakenings were occurring when his heart was struggling most with fluid balance, a classic sign of early heart failure that's frequently mistaken for insomnia or anxiety. Sleep apnea deserves special attention here. This condition, where breathing repeatedly stops and starts during sleep, affects about 25% of seniors and places enormous strain on the cardiovascular system. Each time breathing pauses, oxygen levels drop, triggering stress hormones that raise blood pressure and heart rate. Over time, this pattern damages heart muscle and blood vessels, accelerating cardiac aging. Do you snore loudly? Has a partner noticed pauses in your breathing while you sleep? Do you wake up with a dry mouth or morning headache? Do you feel excessively sleepy during the day despite adequate time in bed? These could all be indicators of sleep apnea that warrant further investigation. Even without apnea, the inability to lie flat comfortably at night, orthopnea, or waking up suddenly feeling breathless can indicate heart failure. These symptoms occur because fluid redistributes in your body when you're horizontal, causing increased pressure in your lungs. Many seniors simply add another pillow to elevate their upper body without realizing this accommodation is actually compensating for a heart problem. Consider your sleep environment and habits carefully. Have you gradually raised the height of your pillows over the years? Do you find yourself needing to sleep in a recliner rather than your bed? These adaptive behaviors might seem insignificant but could actually be unconscious responses to developing heart failure. If your sleep has changed over the past year, particularly if you're experiencing nighttime breathing difficulties, sudden awakenings, or need for elevation, it's time to consider whether your heart might be the underlying cause. Silent sign number 5, subtle changes in cognitive function. Have you noticed yourself becoming more forgetful lately? Perhaps you're having trouble concentrating on your favorite book, or finding it harder to follow complex conversations? While many attribute these changes to senior moments or normal aging, they might actually stem from your heart not providing adequate blood flow to your brain. The brain is extremely sensitive to changes in blood supply. It receives approximately 20% of your cardiac output, requiring a constant flow of oxygen-rich blood to function properly. When your heart ages prematurely or works inefficiently, this delicate balance is disrupted, potentially affecting cognitive performance before more obvious cardiac symptoms appear. Dorothy, a sharp 77-year-old former accountant, started noticing she couldn't focus on her beloved crossword puzzles. "I thought it was just my mind getting older," she said. "I never imagined it could be related to my heart." But a cardiovascular evaluation revealed her heart was pumping at reduced efficiency, limiting optimal blood flow to her brain during mentally demanding tasks. Research has shown that people with poor cardiovascular health experience cognitive decline at faster rates than those with healthy hearts. The connection is so strong that some neurologists now refer to vascular cognitive impairment as heart failure of the brain. Yet because these changes typically happen gradually, many seniors don't make the connection between their heart health and their mental sharpness. Ask yourself, are crossword puzzles taking longer to complete than they used to? Do you find yourself losing track of conversations more frequently? Have family members commented on changes in your memory or thinking? Do you sometimes feel confused or disoriented in familiar settings? These subtle shifts might not be inevitable aspects of aging but rather early warning signs that your heart isn't supporting your brain as effectively as it once did. Particularly concerning is when cognitive changes occur alongside occasional dizziness or lightheadedness. These episodes may indicate moments when your heart temporarily fails to pump sufficient blood to your brain, what doctors call cerebral hypoperfusion. Even brief periods of reduced brain blood flow can damage neural tissue over time, contributing to both cognitive decline and increased fall risk. The good news is that improving heart health often enhances cognitive function as well. Many seniors report clearer thinking, better memory, and improved concentration after addressing underlying cardiovascular issues. This connection underscores how vital heart monitoring becomes as we age, affecting not just our physical vitality but our mental acuity as well. If you've noticed changes in your thinking, memory, or concentration, consider whether your heart might be contributing to these symptoms. Your cognitive health and heart health are more connected than most people realize. Silent sign number 6, changes in your skin's appearance and temperature. Your skin, the body's largest organ, can reveal surprising clues about your heart's condition long before more traditional symptoms emerge. Have you noticed your complexion becoming paler, or perhaps taking on a slightly bluish tint, especially around your lips or fingernails? Or maybe your fingers and toes feel persistently cold, even in warm environments? These subtle changes occur because an aging heart may struggle to pump blood effectively to your extremities. Reduced circulation means less oxygen reaches your skin, altering its color, temperature, and even texture. The medical term for this bluish discoloration is cyanosis, and while its subtle onset might be easy to dismiss, it can indicate significant cardiac compromise. William, an active 83-year-old, first noticed his fingertips turning bluish while gardening on mild days. "I just thought it was the cool air," he explained. "I never connected it to my circulation." But that discoloration was actually an early sign that his heart wasn't delivering fully oxygenated blood to his extremities, a warning sign he unfortunately missed for months. Another skin signal to monitor is unusual bruising or extremely delicate skin that tears or bruises with minimal trauma. While some of this fragility can develop from blood thinners or aging skin itself, it can also occur when poor circulation weakens small blood vessels near the skin surface. Pay attention also to how your skin heals. Have you noticed cuts or scrapes taking longer to mend than they once did? Wound healing requires robust blood flow to deliver oxygen and nutrients to damaged tissues. When your heart isn't circulating blood efficiently, this process slows dramatically. A minor cut that lingers for weeks could be quietly revealing information about your cardiovascular system's performance. Even more concerning is a phenomenon called livedo reticularis, a lacy, mottled pattern of bluish discoloration that appears on the legs, arms, or torso. This distinctive pattern forms when small blood vessels near the skin surface don't receive adequate circulation. While it can appear temporarily in cold conditions, persistent mottling might indicate more serious circulatory compromise related to heart function. Ask yourself, have others commented that you look paler lately? Do your hands and feet remain cold to the touch even in warm weather? Have you developed a blotchy or uneven skin tone that wasn't there before? These observations could provide valuable insights into your heart's health. While skin changes alone don't definitively diagnose heart problems, they can serve as important visual clues that shouldn't be ignored, especially when they appear alongside other symptoms we've discussed. Silent sign number 7, changes in your digestive patterns and appetite. Have you experienced unexplained changes in your appetite recently? Perhaps feeling unusually full after eating small amounts, or developing new food intolerances? These digestive shifts might seem unrelated to your cardiovascular system, but they could actually be signaling heart problems. When your heart struggles to pump efficiently, blood flow redirects to prioritize vital organs like your brain. This means your digestive system may receive less circulation, especially after meals when it normally requires increased blood flow for proper digestion. The result can be digestive discomfort, reduced appetite, or feelings of fullness after minimal food intake, what doctors call early satiety. Consider Helen's experience. At 75, she suddenly found she couldn't finish her normal portions. "I just wasn't hungry anymore," she recalled. "I thought my stomach was shrinking with age." What Helen didn't realize was that her heart was struggling to provide adequate blood flow to her digestive system during meals, an early warning sign of heart failure that's frequently overlooked. This connection exists because your digestive organs and heart share space in your trunk, separated only by your diaphragm. When your heart enlarges or fluid accumulates around it, as happens in some forms of heart failure, it can physically press against your stomach and intestines, reducing their capacity and function. Additionally, medications commonly prescribed for heart conditions often affect digestion as a side effect. Have you noticed feeling bloated or uncomfortably full after meals that once satisfied you perfectly? Do certain foods you once enjoyed now cause discomfort? Has your weight changed without intentional changes to your diet or activity level? These questions might reveal important information about both your digestive and cardiovascular health. Particularly noteworthy is unintentional weight loss in seniors, which some mistakenly welcome as a positive change. However, when heart function declines, the body may enter a state called cardiac cachexia, a complex wasting syndrome where both fat and muscle mass diminish. This isn't healthy weight loss but rather a serious warning sign that your heart isn't supporting your metabolic needs. Conversely, sudden unexplained weight gain, particularly if concentrated in your abdomen or accompanied by swelling elsewhere, could indicate fluid retention associated with heart failure. This weight increase typically happens rapidly, unlike the gradual accumulation that comes from dietary changes. Pay attention to how your digestive system feels and functions. Changes in appetite, digestion, and weight could be subtle yet important clues about your heart's performance that are too often dismissed as simply getting older. Now that we've explored these 7 silent signs, you might be wondering, how can I monitor these subtle changes effectively? The answer lies in comprehensive heart monitoring that goes beyond the basic annual checkup. Traditional heart screenings typically focus on blood pressure, cholesterol levels, and perhaps an ECG if you're fortunate. While these are important, they don't capture the full picture of heart aging. Modern cardiac care now recognizes the importance of monitoring additional markers like inflammation levels, vascular flexibility, and heart rhythm patterns over time. Home monitoring has also advanced dramatically. Modern blood pressure cuffs can detect irregular heartbeats. Wearable devices can track heart rate variability, a key indicator of heart resilience and stress adaptation. Even smartphone apps can now record single-lead ECGs with remarkable accuracy. These tools empower seniors to participate actively in their cardiac care rather than passively waiting for symptoms severe enough to warrant medical attention. Consider Martha, an 80-year-old who discovered her occasional heart palpitations were actually atrial fibrillation through a smartwatch she received from her grandchildren. "I thought it was just anxiety," she explained. "If I hadn't had that watch, I might never have mentioned it to my doctor." That early detection allowed her to begin appropriate treatment before she experienced complications like stroke or heart failure. However, technology alone isn't enough. Developing body awareness and establishing personal baselines are equally crucial. Take time regularly to assess your energy levels, breathing comfort, sleep quality, and the other signs we've discussed. Note subtle changes rather than dismissing them. Your observations become valuable data that help healthcare providers identify patterns that might otherwise remain invisible. It's also important to maintain a heart health journal. Record not just symptoms but also contexts. Does climbing stairs leave you more breathless than it did 3 months ago? Does stress affect your heart rhythm more noticeably now? These detailed observations can reveal gradual changes that might escape notice in isolated medical appointments. Remember that heart aging doesn't follow a straight line. Some days you'll feel better than others. The key is noticing overall trends and patterns rather than isolated incidents. A single day of fatigue might mean nothing. Steadily declining energy over months needs attention. Ask yourself, how carefully have you been monitoring the subtle signals your body sends? Have you been dismissing important warnings as just getting older? Are you actively tracking changes in your stamina, breathing, and overall function? These questions aren't just academic, they could literally save your life. Your heart can be physiologically younger or older than your birth certificate suggests. This concept of heart age versus chronological age has gained traction in cardiology because it better predicts health outcomes than simply counting years lived. Think about it this way: we all know people in their 80s who seem decades younger, still active, sharp, and full of energy. We also know people in their 60s who seem much older, struggling with basic activities, constantly tired, and declining rapidly. Often, the difference comes down to cardiovascular health more than any other factor. Factors that accelerate heart aging include the obvious culprits: smoking, sedentary lifestyle, poor diet, but also less recognized influences like chronic stress, sleep apnea, and certain medications. Even frequent air travel, shift work, or living in areas with high noise or air pollution can age your heart faster than the calendar would suggest. Consider Thomas, a 75-year-old former marathon runner who still had the cardiovascular system of someone decades younger, according to his cardiologist. "My doctor says my heart is about 55 years old," he proudly shared. "I've always prioritized my health, and it's paying off now." Meanwhile, his brother, just 2 years younger but with different health habits, had already suffered 2 heart attacks. Conversely, positive factors can maintain a youthful heart regardless of chronological age. Regular physical activity, particularly strength training and moderate cardiovascular exercise, keeps heart muscle toned and blood vessels flexible. Nutritional approaches emphasizing anti-inflammatory foods support vascular health. Even social connection plays a role, with studies showing that meaningful relationships actually improve heart rate variability and reduce cardiovascular inflammation. The goal isn't to stop aging, that's impossible, but rather to ensure your heart ages at a healthy pace aligned with the rest of your body. This balanced aging process allows you to maintain quality of life and independence much longer than when cardiovascular decline outpaces other systems. Consider having your heart age professionally assessed. Many cardiologists now offer specialized testing that compares your heart's functional and structural characteristics with age-matched norms. This assessment provides a more precise picture than generalized risk calculators and helps target interventions specifically to your needs. Ask yourself, is your heart older or younger than your calendar age? What lifestyle factors might be accelerating your heart's aging process? What positive changes could you implement to maintain a youthful cardiovascular system? These reflections could help you identify critical opportunities to protect your heart for years to come. While identifying early warning signs remains crucial, Preventing premature heart aging offers even greater benefits. Research increasingly shows that many aspects of heart aging previously considered inevitable can actually be slowed, stopped, or sometimes even reversed through targeted interventions. Nutrition plays a fundamental role in heart longevity. Mediterranean and dietary patterns consistently demonstrate cardiovascular protection. These approaches emphasize abundant plant foods, moderate protein, especially from fish and legumes, and healthy fats while minimizing processed foods, refined carbohydrates, and excessive salt. Consider Evelyn, an 85-year-old who adopted Mediterranean eating patterns in her 60s after her husband's heart attack. "My doctor was amazed at my last checkup," she shared. "My arteries are clearer than people 20 years younger. I'm convinced it's because of how I've been eating all these years." Her experience reflects what research consistently shows: dietary patterns really do shape heart destiny, especially over decades. Beyond general dietary patterns, specific nutrients deserve attention. Omega-3 fatty acids support heart rhythm stability and reduce inflammation. Potassium helps regulate blood pressure and counterbalances sodium's effects. Magnesium influences over 300 enzymatic reactions, including many affecting heart function. Ensuring adequate intake of these nutrients, ideally through food but supplemented when necessary, provides foundational support for cardiac health. Physical activity benefits heart aging through multiple mechanisms. Regular movement maintains arterial flexibility, improves insulin sensitivity, optimizes blood pressure, and strengthens the heart muscle itself. Contrary to outdated beliefs that seniors should avoid exertion, current evidence shows that appropriate exercise actually becomes more important with advancing age. Robert, a 91-year-old former teacher, still walks 2 miles daily and does light resistance training 3 times weekly. "My friends thought I was crazy starting strength training at 75. He laughed, "But here I am, still independent while many of them need help with basic activities." His experience reflects mounting evidence that muscle preservation through regular activity is a key factor in maintaining cardiovascular health in advanced age. What constitutes appropriate exercise varies individually but generally includes a combination of moderate aerobic activity, strength training, and flexibility work. Even those with existing heart conditions can benefit from medically supervised exercise programs tailored to their capabilities. The key is consistency rather than intensity. Regular gentle movement provides greater cardiovascular benefit than occasional vigorous exertion. Stress management deserves equal attention in heart aging prevention. Chronic stress triggers inflammatory cascades that accelerate vascular damage and heart muscle remodeling. Techniques like mindfulness meditation, controlled breathing practices, and even simple nature exposure have demonstrated measurable effects on heart rate variability, blood pressure, and vascular function. Sleep optimization completes the prevention foundation. During deep sleep, your heart rate and blood pressure naturally decrease, giving your cardiovascular system essential recovery time. Addressing sleep disorders, establishing consistent sleep schedules, and creating environments conducive to quality rest all contribute to heart longevity. Ask yourself, which aspects of prevention have you been neglecting? Are there small, sustainable changes you could implement today to support your heart health? Remember that even modest improvements, consistently applied, create significant benefits over time. Your heart's future is being written by the choices you make today. As we conclude this exploration of silent heart aging signs, I hope you've gained valuable insights into your cardiovascular health. Remember that knowledge is power. Recognizing these subtle warnings empowers you to take proactive steps before minor issues become major problems. Your heart has been beating faithfully since before you drew your first breath. With proper attention and care, it can continue supporting you vibrantly for decades to come. The key lies in listening closely to its whispers rather than waiting for it to shout. If you found this information valuable, please hit the like button and subscribe to our channel for more health insights specifically designed for seniors. Remember to click the notification bell so you won't miss our upcoming videos on related topics like hidden drug interactions that affect heart health and simple movement patterns that strengthen your heart. Thank you for your attention to this vital information. Until next time, keep listening to your heart, both figuratively and literally. Your future self will thank you.